Welcome back to Razmafsar TV. I'm really happy to have Dr. Lillian Nejad here on our program today. She's a famed clinical psychologist based in Melbourne, Australia. Welcome to Razmafsar TV, Lillian.
Oh, thank you so much. That was a lovely introduction.
Of course, of course. Lillian, could you just tell us a bit about yourself? First of all, let us some personal information, who you are, so our viewers get to know you better first.
Absolutely. So my name is Lillian Nejad. I'm a clinical psychologist. As you said, I'm based in Melbourne, Australia, but you've probably noticed that my accent is not from here. I grew up in the United States, in the Washington, D.C. area. And I also attended and completed my Bachelor of Arts in Psychology at Emory University in Atlanta. Okay. And then I ended up meeting an Australian man while I was traveling, and somehow ended up in Australia for the rest of my life. So okay. That's how I ended up here. So I ended up doing my master's and PhD in Australia. And I've been a clinical psychologist working in a variety of settings since then, including public mental health and university settings as a lecturer and clinical supervisor. And I'm in private practice at the moment. And I also just recently started a new business, which is called Skills for Life, which is basically providing online mental health and well-being courses for people to improve their quality of life at home and at work.
Mm-hmm. Let me just go back to your area of concentration, because as a researcher, I'm always interested in research first, and then we will come back later. Could you tell us in which area of psychology you concentrated on during your studies?
Well, initially, I was very interested in addictions. And I was planning on doing my PhD work on why people choose to use substances and do risky behaviors. But it actually ended up that the supervisor available to me was not in addictions. She was an expert in eating disorders. So what I ended up doing was applying risk-taking behavior to unhealthy, risky eating behaviors or not eating behaviors. So I studied fasting and dieting, and tried to work out why people make the decisions to fast and diet, even if we generally know that it's not good for you. So I use particular models to try to predict whether people would choose to diet or fast. The models were called the health belief model and the theory of planned behavior, and tried to work out how we could make sense of it.
Wow, excuse me, I'm listening to you like this because, oh God, okay, I'm going to explain why I'm so shocked a bit. Because, possibly, I do lots of sport on a professional level, and my team as well. So I'm constantly on diet for my sport, not constantly, but most of the time. That's the reason I was just a bit shocked for you as an expert are saying that. Could you just tell us why diets are not healthy?
Oh, look, when I talk about diets, I'm talking mostly about the ones that are time limited and that are unhealthy in some way. So it usually, diets are so prevalent, and they have been so prevalent since, as long as I've been alive. But in the 80s, when I was growing up, it was all about crash dieting and calorie counting and taking certain segments of nutrition out of, your life. Don't eat this, don't eat fat, or only have 1,000 calories a day. And also, the behaviors that I was studying were the ones that were more associated with eating disorder. So when I say fasting, I don't mean, fasting in some of the diets that they're doing now. I'm talking about starving yourself, like in order to lose weight. So that was what I was studying, like people who are dieting and fasting in order to lose weight, not in order to, do a particular sport, for instance, where you might need to be on a particular diet for something like that.
Okay, yes,
Oh, yes.
I'm
I
really
need to
happy to
clarify.
hear. I was feeling guilty. So please, I would like to admit I did it. Help me, right?
Oh,
Okay.
look, everyone's done dieting and fasting, it seems like, to some extent for a variety of reasons. And some of those reasons are for health and are healthy, and some of them aren't. And I was studying the ones that were not healthy.
Okay.
Yeah.
And this was the topic of your PhD, Lillian, correct?
Yes, that's right.
Okay.
And I guess the part that I was most interested in, was not so much the actual behavior that I was studying, but more the mechanisms of how people make decisions and why they make those decisions. And particularly decisions that aren't particularly good for us. So that was what I was most interested in. It didn't really matter which behavior I was studying. Like I said, I was initially interested in understanding why people choose to use various substances that aren't good for us. But they're all related, why do we make those decisions that aren't particularly healthy?
Let us just discuss about about this topic, then we can go ahead. Because when I have an expert like you, I would really love to ask as many questions as possible, if you don't mind. Is it
Sure.
these kind of decisions made on peer pressure, group pressure, people we interact with? We know, for example, from Greek philosopher Aristotle, that we are social animals already in ancient Greece. So
Right.
tell me who your friends are, as Aristotle said. I tell you
Mhm.
who you are. That's, as we know, is based on virtue ethics, which we use in leadership. So hang around with people, hanging around. We are social animals. As you know, Lillian, people
Yes.
always say, I make my decisions on your own, on my own. And we know, buying a car, I would have never ever seen any person who buys a car and takes or makes her decision on her own or his own. You go and ask people
Yeah.
around, right? So is
Yeah,
it
you do a lot of research.
yeah, exactly. Is it because of peer pressure that these eating disorders also could happen or have an influence on?
Yeah, look, there are multiple factors that impact on these decisions, but you're absolutely right that who who we are around makes a difference. And one of the major factors that predicted those kinds of choices in the study that I did was seeing people do those behaviors. So having models in their environment who were doing them. So it didn't matter if those people said that you shouldn't do it. It mattered more if they were doing it themselves. Right. So, as for instance, as a parent, you might say, don't do this, don't do that. But if your child is seeing you do it, that's what's most important. That's what's going to lead to the behavior more than what you say.
Wow, that's right.
So that's one aspect that can lead to those behaviors. The other thing is just how we think, like what our beliefs are.
Could you expand on
Um,
it? What do you mean?
Well, we might have. So one of the other predictors in my particular study was just what people believed about dieting and what the outcomes were going to be. So if they thought that the outcomes were going to be positive, then they were more likely to do it. That makes sense, right?
Yes, absolutely.
Um, Even though there's a lot of information out there, that crash dieting is bad for you or starving yourself is bad for you. If they believed that they were going to get some positive consequences and they were going to be successful at achieving it, then they were more likely to do it. So our thoughts definitely have a huge impact on our behavior. And we certainly know that as psychologists, and we work with people on their thoughts and their beliefs to help them shift their behaviors and their feelings.
Oh, okay.
So
So
that aspect is really important too.
for example, if I come to you as a psychologist and I tell you, okay, Lillian, I have this and this, or developed eating disorders, and so then you help me to get rid of these
Not
eating
with
disorders,
talking
right?
therapy.
Yes.
Yes. Okay. So it depends on the eating disorder. I actually didn't go on to specialize in treating eating disorders, but I do know the process. So depending on the eating disorder. So for anorexia nervosa, where people starve themselves and they get to a very, very low weight, one of the first line treatments is really to help them gain weight more than doing talking therapy to start with. Because if you're at a very, very low weight, you can't think properly. And so if you can't think properly, you can't actually do the talking therapy treatment. So with people with other disorders, they might be have bulimia or binge eating disorder where their weight is actually healthy, or they might be a little bit overweight. You can do talking therapy then. So then you would be talking about, what led to the issue, what outcomes were they after, and then you would help them modify their beliefs that have to do with mostly themselves and what it actually means to them to be who they are, and what it would mean to them, what it actually meant to them to be a certain weight, because a lot of people have these kind of irrational beliefs about how weight can improve your life, or that it means that you're a better person in some way.
Oh, yes.
So it's about unpacking those types of beliefs.
A better person is like that, this social pressure around us that sometimes could be like fat shaming or all these type of activities going on, especially among teenagers. Is it what you're pointing at?
Yeah, well, there's certainly, there's a lot of judgment towards people who are really of any weight now. We judge people for being too skinny. We judge people for being, overweight. We judge people for all sorts of things. And we're all affected by that. We're all guilty of it, and we're all affected by it. So it is definitely something that we need to be aware of.
Okay. Lillian, I'm sure I'm not the only one. I'm sure there are many people, or there are some people who might mix them up. What is the difference? And you as an expert, tell us, what is the difference between a bulimic person, or bulimia, and anorexic person? What is the difference between the two?
Well, generally, anorexia is associated with withholding food, so not eating, and being an extremely low weight. Okay. Whereas bulimia is a mix of behaviors of not eating and also purging food and eating. So not eating and eating, and then when they eat, purging their food via a variety of methods. And often they stay this kind of a normal weight. They don't tend to lose as much weight as someone with anorexia. And binge eating disorder is when you are eating too much in particular, short periods of time and in intense moments of time, which can usually cause you to gain weight.
Okay. Lillian, could you tell us, now the topic of your dissertation for us, because many researchers watch this channel. Could you tell us the topic of your dissertation?
That was what I was talking about. That was the topic of my dissertation.
That was the topic.
Yeah,
okay.
yeah, yes.
Perfect. And then tell us more about that. Then after that, you changed your area of concentration. So let's move in that direction. Okay, go ahead, please.
So yes, I ended up working for a community health service in Melbourne, which meant that I needed to have more of a broad expertise, be able to see people who came in with a variety of problems and be able to treat them. And as you probably know, the most prevalent problems in our society are anxiety and depression. So my focus was on treating people with anxiety and depression issues. And then I went into public mental health and worked with more severe cases. So people who had more severe forms of anxiety and depression, but also people who had psychotic disorders like schizophrenia and schizoaffective disorder, and more severe mood disorders like bipolar disorder, kind of the whole range. Working on inpatient psychiatric wards and working with those people when they were in the community as well, and helping people who had emerging psychotic symptoms as well. So I did that for many years, and then I stepped out on my own and started my private practice, where I am again concentrating more on supporting people with anxiety and depression and related
fields of leadership, which is extremely difficult. And of course, we need people like you, because we are not, or my clients are not trained psychologists. They're business leaders. More and more employees are or suffering from depression or anxiety, right?
Mm-hmm.
You see that clearly. And sometimes you see that also often, especially in cities where I live, like in Frankfurt, financial center. And so you see in the faces of people, and I know you might, as an expert, say, what are we talking? That people are suffering from some sort of depression or so. Let us just distinguish between depression and anxiety. Oh no, let's explain anxiety and then explain depression for us, please.
No worries. So anxiety, look, anxiety is a normal human physiological experience.
Okay.
So not all anxiety is related to having a disorder. We all experience anxiety. And anxiety is there to serve a protective function. So it's there to help us stay alive. It's there to help us detect threats in the environment and then to react in a way that's going to help us and keep us safe from harm. Through a few different methods. The main ones are to fight off whatever is causing the threat, to flee from whatever is causing the threat, and also sometimes to freeze in response to the threat. So those are the main things. So we don't necessarily want to get rid of anxiety. In fact, we can't actually get rid of anxiety. We actually need it to survive. But sometimes what happens is anxiety can sometimes occur when there's actually no threat in the environment. Sometimes it can occur too frequently. Sometimes it can last too long. And sometimes it can cause, significant impairment in other areas of our life. So when it's too intense and too severe for the situation, and when it's too frequent or too long, then we might have more of an issue that we need to potentially get treatment for.
Wow. Okay. And anxiety, I mean, of course, you need a professional to just tell you if you are suffering from anxiety, which reached, a disorder, correct? You cannot recognize it yourself, or can you?
Well, possibly. If you are finding that your responses seem more severe than most, and it's harder for you to calm down, and you are finding it difficult to relax and maintain, stability and balance in your life, and it's causing significant problems with your relationships or with work, then you've got a problem. It might not be a disorder, but it's probably something to get some support and help for. So it would be really useful to, at the very least, see your GP, but to see a psychologist or a professional, a mental health professional, so they can assess and say, here are the issues that you have, and here is the possible avenues for treatment, because it's a very treatable issue.